Good evening. I am Dr. Manish Sharma, presently working Sacred Heart Hospital as a nephrologist here. Today session we will discuss the kidney disease or CKD and its association to the period edema along with its causes, symptoms and treatment. First let's see what chronic kidney disease is. It is the continuum permanent degeneration of kidney is known as chronic kidney disease. As we know, the kidneys are the vital organ of the body, human body. They serve a variety of purposes, including maintaining body minerals, electrolyte balance, assisting in production of red blood cell, maintaining the acid-base balance, and other excreting the water-soluble wastes. Kidneys that have been damaged, they lose the capacity to execute these functions. As we know, there are 5 stages of the kidney disease. We are categorized in the CKD stage 1 to CKD stage 5. In the CKD stage 1, the kidney is normal, but with more than 90% of the kidney function properly. We categorize the CKD stage in the GFR. In the CKD stage 1, the GFR is mostly more than 120. In the stage 2, the kidney function mildly decreases and it's about 60 to 89%. In stage 3, the kidney function decreases mild to moderately and is up to 30 to 59%. And in stage 4, the kidney function severely decreases and it is about 15 to 29%. In the stage 5, it is known as end-stage renal disease and the GFR is less than 15%. Since the kidney can compensate for lost function, signs and symptoms may not appear until the permanent damage has occurred. Some of the commonly observed CKD symptoms depending on the severity are: the first is the swelling, second anemia, there may be hypertension, there will be other disorders like sleep problems, patient have diminished mental sharpness, muscle cramps and decreased appetite. So as we look at the sign and symptoms of CKD, one of the major symptoms is period edema and that is swollen feet. So I am discussing what is period edema is. Period edema is the swelling of the feet and ankles caused by abnormal buildup of fluid in the ankles, feet and lower legs. How this edema forms in the chronic kidney disease is either due to the 2 reasons. One is the heavy loss of the protein, the second is the impaired kidney function. So the period edema can also occur when sometimes someone stands or sits in same posture for extended period. The symptoms of period edema include swelling and puffiness of tissue just beneath the skin, skin that is stretched or shiny, skin that is retains a dimple or pits after being pressed for several seconds. Let's take a look at ways how we can reduce the period edema and which is caused by chronic kidney disease. Treatment of edema includes addressing the underlying cause. First, we have to lower the salt intake. In lowering salt intake, it means we have to take the salt which is less than 5 grams per a day. And so we know that the salt mainly present in the processed food, so we have to avoid the processed food, and by reducing the salt consumption we can help minimize the edema. And if edema is so severe, if it is refractory to the simple behavior methods, then we can add on therapy with medical treatment in the form of diuretic. What is the use of diuretic? Diuretic these are the drugs that induce kidney to eliminate more salt and water and hence reducing the edema. Because the eliminating too much fluid can drop blood pressure, it causes lightheadedness and fainting, and it damages kidney function. Thus diuretic must be administered with caution. After using a diuretic, you may need empty your bladder more regularly. However, when diuretics are used at the prescribed dose, adverse effects are less or infrequent. Another way is how we can reduce the period edema is the compression stocking. It can used to both prevent and treat leg edema. Also good measure, and fitting of stocking can limit the risk of discomfort. Certain stockings can cause skin irritation or pain. Effective compression stocking exert the most pressure at the ankle and progressively decrease pressure up to the leg. Another one thing is body positioning. We can elevate the legs above the heart level for about 30 minutes, 3 or 4 times a day. It can help. It can reduce the leg, ankle and foot edema. Lastly, it not always possible to prevent CKD. Controlled disease measure like high blood sugar, controlling sugar, high blood pressure, controlling sugar, and other measures can reduce and decrease the progression of the rate of chronic kidney disease. If you are a high risk for CKD, you should get regular testing in the form of renal function test, urine routine test has to be done, and early detection of CKD can aid to slow its progression. So finally, in conclusion, main method is limiting salt intake, choosing foods with low potassium, and have good physical activity can reduce the edema and further symptoms of chronic kidney disease. Thank you.